I'm Dr. Anthony Collada. I'm a board certified psychiatrist. In this video, I'm going to talk to you about steps to treat depression. Now, there's a difference between feeling sad or depressed for like a few hours or for a few days versus a clinical depression. A clinical depression is a constellation of symptoms that you need at least 5 of 9 over a 2-week span, in which people may suffer from a sad or depressed mood, not enjoying life or not doing it pleasures that they enjoy. Maybe they have guilt, feel worthless, energy problems, appetite changes, sleep changes, maybe their activity level has changed where they're moving too much or too little, concentration problems, or it can get so severe that they have thoughts of suicide. Sometimes they can also feel hopeless, helpless, or worthless. So you have a constellation of at least 5 of those symptoms for at least 2-week span. Also, to be considered clinical depression, not only have 5 of those 9, but also it's negatively impacting such your family relationships, maybe your work or school, or your friendships. So it negatively impacts your life. Also, these episodes cannot be due to something like drugs or alcohol. And so there are different severities of a depressive episode. The severities can range from mild, moderate, or severe, and there's different rating scales one can use to see how severe it is. But when it's severe, it's typically recommended to get both medications and therapy to treat it. When it's mild or moderate, it doesn't necessarily need medications. Maybe you could use one or the other. Typically, using both is optimal ways to treat it, but that's not necessarily the case, and maybe some people prefer one approach over the others. When it comes to medications, there are several different types of medications that are thought to work. There are medications that work on the serotonin neurotransmitter, medications that work on norepinephrine and dopamine, medications that work on both serotonin and norepinephrine. Sometimes one medication is sufficient to help treat the symptoms. Sometimes it takes medications that work differently to help treat it, or a combination of ways. Sometimes you need both medications and therapy. And then also with therapy, there's different types of therapy approaches one can take. You can do cognitive behavioral therapy, which is essentially changing the thoughts, so that'll change the feelings and change the actions. There's also this notion of behavioral activation, where you kind of just force yourself to do the activities that you enjoy that are healthy, even if you're not feeling like it, because if you force yourself to do it, that's going to help you to get out of that depression and start enjoying life, enjoying activities. Just overall having good self-care, eating healthy and exercising can be steps in the right direction to help alleviate the depression. Having good social community or social network. Sometimes just talking with a therapist about some of the stress or conflicts in life can help alleviate that, because the body likes a certain amount of stress. A certain amount of stress can help one to be energized, motivated, enthusiastic. But if there's too much stress or too little stress, that body's equilibrium can get out of balance, and that can lead to symptoms of depression or anxiety. And sometimes one doesn't even need to talk to a therapist. You may feel more comfortable talking with someone like in the religious or spiritual community, such as a rabbi, an imam, or a priest. That may be sufficient to help alleviate some of this depression symptoms one is going through. Anyways, there's many ways to treat depression. Be sure to talk with your doctor or therapist about if it's something that you're going through and see what's the best ways for you. But as you can see here, there's many different approaches to treat it.